Hello anatomy friends, this is Dr. Alsup, and in this video we will be discussing the deltoid muscle. And I know it seems a bit odd to just be focused on one muscle in a learning objective video, but this is an important one, so we want to spend some time discussing the location, innervation, and of course the actions associated with the deltoid. So my guess is that even if you have never had anatomy before, or musculoskeletal anatomy, you likely have a vague idea of where the deltoid muscles are located. Sometimes when associated with exercise, you may hear this referred to as your delts. I often lovingly refer to it as your thick shoulder cap. It sits superficial to and covering the glenohumeral or shoulder joint. And it's really that muscle that gives the shoulder region the distinct rounded contours that are visible. So if you put your hand over your shoulder and palpate, you can feel your deltoid muscle deep to the skin and subcutaneous tissue. Proximally, this muscle has an attachment, and we're looking at a posterior view here. You can tell because you can see the majority of the scapula. So proximally, this muscle has an attachment to the bones of the pectoral girdle, so both the clavicle as well as the scapula, specifically on the acromion and the spine of the scapula. And the distal attachment is actually on the shaft of the humerus in a region referred to as the deltoid tuberosity. So this muscle crosses and can directly affect the actions of the glenohumeral joint, to that shoulder joint. So speaking of actions, let's explore this a little bit more. And what I want you to take away regarding deltoid actions is that it is the primary abductor of the shoulder joint. So pulling the arm away from anatomical position in the coronal or frontal plane. So think lifting your arm to point to the side. So by far the most powerful and primary abductor of the shoulder, but it needs a little help at the beginning of the movement, so initiating the action of abduction, and it gets that through the contraction of the supraspinatus muscle, which is one of the rotator cuff muscles. It will be located in this general region right here. And we'll talk more about that in upcoming videos. Now, I do want to note that the deltoid is actually pretty complex in composition. It has 3 separate parts that can contract independently, and those different parts can actually produce movements that are antagonistic or opposing actions. So one part can oppose the action of the other. So you can have flexion as well as extension, and medial or internal rotation as well as lateral and external rotation, dependent on which part of the muscle is contracting. So if you look at the movements that are possible with contracting or with contraction of the different parts of the deltoid, it actually is capable of almost every type of action possible at the shoulder joint except for adduction. So you can see how hugely important this muscle is to the shoulder region. I do want to note that no muscle works in a vacuum. Typically, multiple muscles are working in unison to produce an action. So there are almost always more than one muscle that can play a role in a specific action. So there'll be more than one muscle that produces flexion at the shoulder joint or extension. However, there is typically a prime mover or most powerful muscle for certain actions, and this can change based on positioning of the joint or other factors. But really, the deltoid is almost always, and I would almost err on saying always, the prime mover in terms of abduction of the shoulder joint past the first 15 degrees of that movement. Another important relationship we want you to walk away with is the fact that the deltoid muscle is innervated by the axillary nerve, so one of those terminal branches of the brachial plexus, and this nerve is located deep to the muscle. So you can see the deltoid muscle has been reflected, and you can see the axillary nerve right there. If there's an injury or damage to the axillary nerve, this can affect the deltoid muscle and potential for movements associated with that, and it can even lead to atrophy of the muscle if severely damaged. One thing also to note, the deltoid muscle is a notably thick and coarse fibered muscle, and because of this and its superficial location, it's a common site for intramuscular injections. And so because of that, you need to be aware of the location of that axillary nerve deep to the muscle and taking care to avoid the axillary nerve in its more posterior position. Excellent. So that is the deltoid muscle in a nutshell, those big picture concepts we want you to walk away with. I hope you take time to review this, and always feel free to reach out with any questions. Thank you for your time and attention, and have a great rest of your day.